A teenager, alone in their room, staring blankly at their phone. Always check if they look tired and defeated, as they could be overwhelmed by the pressures of school, social media, and family expectations. Welcome to today's video where we delve into depression in teenagers and how to notice the signs and seek help. First of all, let us look at what depression is. The World Health Organization states that depressive disorder, or depression, is a common mental health condition that can happen to anyone. It is characterized by a low mood or loss of pleasure or interest in activities for long periods of time. This is different from regular mood changes and feelings about everyday life. Depressive episodes last most of the day, nearly every day, for at least 2 weeks. People with depression may experience disturbed sleep and changes to their appetite. They may have feelings of low self-worth, thoughts about dying and hopelessness about the future. Tiredness and poor concentration are also common. Depression results from a complex interaction of social, psychological, and biological factors. People who have lived through abuse, severe losses, or other adverse events are more likely to develop depression. Problems at school and work can also result in depression. Prevention programs have been shown to reduce depression. There are also effective psychological treatments and medications for depression. However, these are often absent or inaccessible, especially in low and middle-income countries. It is estimated that more than 75% of people experiencing mental disorders in low and middle-income countries receive no treatment. Did you know that the World Health Organization stated that at least 350 people live with depression? It is a leading cause of disability worldwide. It affects not only the person with depression, but their loved ones too. Yet, many of us are in denial. Depression remains hidden, not treated or talked about. Do you know someone who suffers from depression, or do you believe depression does exist? Let us know what you think in the comments section. In today's fast-paced society, many teenagers are struggling with depression. The constant pressure to be perfect, to fit in, and to keep up with the demands of school and social media can take a toll on mental health. But take heed, there is hope, because with the correct tools and strategies, teenagers can beat depression and thrive in today's world. Signs of depression in children. The Whole Child, a charitable organization based in the United States of America, stated that signs of depression in children are noticeable if you pay attention and are observant. If one or more of the following signs of depression persist, parents should immediately seek help. Frequent sadness, tearfulness, crying. Hopelessness. Decreased interest in activities, or inability to enjoy previously favorite activities. Persistent boredom, low energy. Social isolation, poor communication. Low self-esteem and guilt. Extreme sensitivity to rejection or failure. Increased irritability, anger, or hostility. Difficulty with relationships. Frequent complaints of physical illnesses such as headaches and stomachaches. Frequent absences from school or poor performance in school. Poor concentration. A major change in eating and/or sleeping patterns. Talk of or efforts to run away from home. Thoughts or expressions of suicide or self-destructive behavior. A child who used to play often with friends may now spend most of the time alone and without interest. Things that were once fun now bring little joy to the depressed child. Children and adolescents who are depressed may say they want to be dead or may talk about suicide. Depressed children and adolescents are at increased risk for committing suicide. Depressed adolescents may abuse alcohol or other drugs as a way to feel better. Children and adolescents who cause trouble at home or at school may also be suffering from depression. Because the youngster may not always seem sad, parents and teachers may not realize that troublesome behavior is a sign of depression. When asked directly, these children can sometimes state they are unhappy or sad. The Whole Child stated that this information has been made available from the Los Angeles Network of Care. 1. Seek professional help. If you are feeling overwhelmed and struggling to cope, do not hesitate to reach out to a therapist or counselor. They can provide you with the support and guidance you need to navigate through your depression. If your doctor is unable to refer you to a therapist or counselor, then you should try approaching these professionals directly or through a professional who is knowledgeable about the subject matter. 2. Build a support system. Surround yourself with positive and caring friends and family members who can offer you a listening ear and a shoulder to lean on. Do not be afraid to confide in them and ask for help when you need it. If you find it difficult to speak to them initially, then try approaching the pastoral lead at your school and ask them to speak with your family or guardian. 3. Practice self-care. Take care of your physical and mental well-being by prioritizing self-care activities such as exercise, healthy eating, meditation, and getting enough sleep. These activities will help to boost your mood and reduce stress. 4. Set realistic goals. Instead of striving for perfection, you can set small and achievable goals for yourself. It is important to celebrate your accomplishments, no matter how small they may seem, and do not judge yourself too harshly if you fall short. Tell yourself that you can always plan and try again. Five. Disconnect from social media. If teenagers spend too much time observing social media, it can often exacerbate feelings of inadequacy and comparison. You should take breaks from your devices and engage in activities that bring you joy and fulfillment, such as spending time with your family and siblings or friends, instead of spending too much time on social media or playing computer games. Professor of Psychology Dr. Jean Twenge at San Diego State University stated, around 2012, something started to go wrong in the lives of teenagers. In both the US and UK, rates of depression among teens started to rise. By 2019, even before the COVID-19 pandemic hit, they had doubled. More and more teenagers around the world said they felt lonely and like an outsider at school. This wasn't just due to teenagers being more likely to admit to negative feelings. Behaviors connected to poor mental health, like self-harm and suicide attempts, also rose around the same time. At first, the cause of these trends was a mystery. They didn't line up with economic shifts, family trends, or world events. But something did start to change in the lives of teenagers around 2012. More started to use smartphones and be on social media for several hours a day. At the same time, teens also started spending less time with their friends in person and less time sleeping. This is not a formula for good mental health. 6. Find a creative outlet. Teenagers should try spending valuable time periods exploring their creative side. It could be through writing, painting, dancing, or playing an instrument, and trying to find a creative outlet that allows you to express yourself and release pent-up emotions. It is important to note that with a combination of seeking professional help, having a strong support system, prioritizing self-care practices, setting realistic goal setting, actively disconnecting from social media, and finding a creative outlet, teenagers can overcome depression and thrive in today's fast-paced society. It is important for parents and guardians to spend time being observant to try and notice if there are any changes which may take place in their teenagers' behavior or presentation and make a plan to support them. The teenager can be encouraged to spend time in activities with friends, engaging in a creative activity, and will hopefully end up feeling lighter and more hopeful about the future. The World Health Organization stated, at least 350 million people live with depression, and it is a leading cause of disability worldwide. It affects not only the person with depression, but their loved ones too. Yet, many of us are in denial. Depression remains hidden, not treated, or to local charities that deal with mental health. You must ask the doctor about the availability of support and treatment. If you are not satisfied with the treatment, ask questions and ask for a second opinion and seek other services which could help. If one is prescribed antidepressants, then their effect and side effects need to be monitored by trained healthcare professionals. In some cultures, if somebody is depressed, Objectively, due to that society being uninformed about depression, they may mistake the individual's behavior or presentation of lacking energy or desire to engage in activities as laziness. If you are a teenager and your society does not have empathy towards you experiencing depression symptoms, then you need to seek an empathetic ear of a doctor or healthcare talked about. It must be emphasized that depression can be treated and one can live a normal life. It is said that girls are more susceptible to depression amongst teenagers. There can be a stigma attached to someone who suffers from depression, and if not treated in time, it can carry on into adulthood and can also lead to suicide. Let us know your thoughts in the comment section. We believe you have learned something valuable from this video. Like, subscribe, and hit the notification bell so you do not miss any other new videos when we upload them. Pass this message on, and it may help someone and will aid in building a supportive community. It is important to remember that you are not alone in this journey. It is by taking small steps and implementing these strategies that you can break through depression and reclaim your mental health and happiness. By taking note of these strategies, it will help you to stay strong, stay resilient, and never give up on yourself. You deserve to thrive.